tonight on Dr. Phil Primetime. Your daughter begged you both to help medically end her life.
As a father, it was so difficult to watch her suffer like that.
He says legalization means intentionally killing vulnerable people.
It's very common for people to say, hey, let's get this over with. That's the reason there's laws to not help people commit suicide.
So you're saying my daughter wanted to commit suicide?
With medicine?
No, she died of cancer.
My option is to end my life, and that's the option that I'm choosing.
Tonight, we're continuing the conversation about a controversial end-of-life option only legal in 10 states and Washington, D.C. It's called medical aid in dying, also known as MAID, where a competent adult with a terminal illness is prescribed a self-administered lethal medication to end his or her life. Last night, we spoke with guests who all say their emotional and heartbreaking stories are the very reason why medical aid in dying should be legal for those who desperately need it. Here's what happened last night.
I have a permanent spinal cord injury called spinal cord myelopathy. I feel like I'm trapped in a body. What I choose is quality of life over quantity of life.
You say if your pain doesn't subside, you plan to medically end your life.
Correct. I can picture myself in that bed at the clinic pressing the button. I imagine relief of pain. I deserve a peaceful death. If there's a doctor out there that knows of something, I'm open. I want there to be an answer, but I'm also understanding that there isn't.
When the day arrives for Meg to medically end her life, her best friend will be by her side.
Once I saw that her quality of life really was diminishing, I started to think, I don't want her to do it, but I understand. I don't know how I'm gonna live the rest of my life without her. I have to be there for her, and it will bring us both peace.
I don't believe that people have to suffer. I think it is their choice.
Darren and Amy say they watched their daughter go from a vibrant 24-year-old woman to being given weeks to live after a terminal cancer diagnosis that metastasized from her tongue to her whole body.
It was very difficult for the palliative care team to stay on top of that pain.
At that point, she said, Mom, I would like to do medical aid in dying.
It's not legal in the state of New York. So Ayla was in a lot of pain right through the end of her life. The cancer would outpace the morphine levels. She was on enough opioids to kill a room full of people. When you have someone suffering at a pain level 10 like that, that's inhumane. I'm sorry. And it's a personal choice. I hated seeing her in pain. It was so difficult to watch her claw at her neck and whine and suffer. So I just sat down and looked her right in the eye and held her hand, if I can, Dr. Phil, held her hand like this and said, it's time, Ayla. You can go. You don't have to be in pain anymore. You can move on. And she found the door.
And it was so peaceful.
Now, we add to that those that are in intractable pain that just simply has gone down every path, looked at every option, and there's just nothing available. Joining us is Jessica Scarcella Spanton, who is a member of the New York State Senate for the 23rd District. Now, she is fighting for medical aid in dying to be legal in the state of New York. Thank you so much for being here. You're working to make this legal in New York. How's the fight going?
It's quite a fight in New York. This bill was introduced in 2015. Before my time, my predecessor actually carried this legislation, and it can never seem to get as much support as it has. And just as your poll stated, 72% of Americans support this. 72% of New Yorkers support this as well. But there's been so much pushback and so much fear around allowing this in New York State. But this year, more than ever, thanks to the story of the Eilerts, thanks to many of the advocates, it did pick up a tremendous amount of traction. And every year, we're going to have to come up with something new, a new way to try to get this done.
And why do you think 72% of the people support it?
I think that every single person sitting in this room right now have either lost someone that they loved, watched them suffer, or they know at some point that may happen to themselves. Most of the people who opt for medical aid in dying in the states that already do have it are doing so they have peace of mind. Some people don't even end up using it, but just having that peace of mind that they can use it on their worst day is what alleviates a lot of that anxiety. So I think at the end of the day, if someone really thinks about this and you bring it to them, it's not necessarily one of those issues that somebody will bring up to you on their own. But when you bring it up to them and they're faced with the thought of the end of their life and if they're suffering and what kind of burden that might leave on their family as well, they would want this option.
And why do you think the 28% that don't support this don't support it?
I think the 28% might be in the state legislature in New York, but truly, I think it is a discomfort around talking and thinking about death. And I have spoken to literally every single one of my colleagues on this, and people who are not open to supporting this simply are just afraid of, I think, attaching themselves to something to do with death. And it's almost the ideas, if you talk about it, if you put it out there, it comes to you. It sounds a little crazy, but that's been my perspective. There's a religious component as well. I tell people I was born and raised Catholic. I am Catholic. I also went to an all-girl Catholic school, so we have that in common. And my takeaway from growing up Catholic, and again, I'm raising my kids Catholic, is do the right thing. I actually saw my principal from my high school the other day, my all-girl Catholic high school, Sister Antonia, who said, always do the right thing. And to me, this is doing the right thing because it's giving people peace and giving people choice. But if you are religious and this is something that you don't support, I always say don't use it for yourself. There's a lot of things that we legislate that are not from the religious angle. And I think this is one of those that if you're not comfortable using this, you don't have to avail yourself to this choice.
Well, there's also the ethical standpoint because doctors take an oath.
Yeah.
The simplest is the part of the Hippocratic Oath, which loosely translated is, first do no harm. Mm-hmm. And here they're, even though they're not administering it, they're enabling it. They're making the cocktail. They're providing it to the patient to end a life. And so there is the ethical component. And there have been some doctors that have been actually prosecuted for second-degree murder or manslaughter for participating in something like this.
Well, I think that among doctors, there's a varying array of opinions. The Medical Society of New York actually just came out in favor of medical aid in dying. And in New York's legislation, we actually have a carve-out that if you are ethically opposed as either a doctor or a pharmacist, you do not have to prescribe this medication. But it goes two ways. First, do no harm. And I think some physicians will see this as causing harm to another human being, but some physicians see the suffering as allowing harm to continue for someone who doesn't want to suffer anymore.
Well, when it comes to the fight to legalize medical aid in dying, in other parts of the country, there is serious opposition. After the break, we're going to meet a man at the forefront of the fight because he believes that medical aid in dying is not helping, but killing and assisting the suicide of vulnerable adults. And you may not agree with what he says, but I can tell you he's sincere, he's passionate, and I have a lot of respect for his position. We'll meet him after the break.
We're all going to die, and no one's excited about it. That isn't what this is. It's about changing the law to make it legal to cause a death.
I think it's giving people the ability to choose to self-determine how they end their suffering at the end of their life.
You don't give that
Legalized
ability to
daughter.
someone who's on the ledge of a building.
So you're saying my daughter wanted to commit suicide?
You've worked with hospice,
Yes, ma'am.
and you've been next to dying people.
Many.
You would not be with my daughter like this. You would listen to her.
I actually would talk to the doctors first because I don't think your daughter got proper treatment, to be honest.
I think it's beautiful for people to be able to choose their own ending, especially when somebody's been given a truly scary terminal diagnosis that really leads to a life of suffering.
I did inpatient hospitalist, and I saw thousands of deaths that were so deeply traumatic and uncomfortable. And so I believe that when people are suffering and it can't be relieved, that death is a dignified thing that I can provide to them.
When people don't have access to medical aid in dying, they will sometimes take matters into their own hands with tragic consequences. I am all for medical aid in dying, and I think it should be federally legal.
Well, joining us now is Brian Johnston, who is the author of Death as a Salesman: What's Wrong with Assisted Suicide. He says legalization means intentionally killing vulnerable people. It's good to see you again.
You too, Doctor. Pleasure to be
Now,
back.
Brian has been on Dr. Phil before, and we've talked about this before. I know you're very passionate about it and very knowledgeable about this. And you do have an opposing view, which I think is very important for people to hear, a voice given to that side of this conversation. So that's why I asked you to come back.
Well, thank you. And I wrote that book back during the Kevorkian era.
Mm-hmm.
Many remember Kevorkian. This is the same issue. This is the same issue. And so there's been a change in the language, but my background originally is in comparative languages, and it's very clear that semantics are used to exploit, this is an emotional issue, to exploit people's emotions. And that was the case with Dr. Kevorkian. At that time, Dr. Kevorkian was not a very romantic figure. Meg, however, is an extraordinary woman. And my experience as Commissioner on Aging in California, and I've worked with the disabled, and I was on the Board of Examiners of Nursing Homes in California. Most of the killing that goes on right now in California are not on television. They're not romanticized. They're people who actually don't see family. And many nursing homes in California and across the nation, sadly, have become warehouses of humanity. And so that's where this is going to be implemented. That's where it's being implemented right now in Canada. Medical aid in dying, again, it's a euphemism. I'm going to die, you're going to die. We're all going to die, and no one's excited about it. That isn't what this is. This is about changing the law. That's why we have a lawmaker here. It's about changing the law to make it legal to cause a death. And in English, that's a different word that's not being used.
I think it's giving people the ability to choose to self-determine how they end their suffering at the end of their life.
You don't give that ability to someone who's on the ledge of a building. And there's a reason that society sees desire for suicide as a deeper issue. There's a reason in California we call it 5150. Mm-hmm. Someone may be a threat to themselves or others. And so we literally use the law. You want to use the law to say, get rid of them.
But I'm not suicidal.
Okay, she's not suicidal. We're getting somewhere.
My
Bill.
daughter wasn't suicidal.
Our daughter wanted to live. She was so passionate about life.
Okay, so let's pretend this is not suicide. Let's change the language. Mm-hmm. It still is suicide.
So you're saying my daughter wanted to commit suicide?
With medicine?
That's
right.
That's what you're telling
is that
me.
What killed her?
No, she died of cancer. She wanted medicine because she was in pain.
I'm a hospice volunteer myself. Last time we were on, we spoke about the most famous hospice psychiatrist and expert, Elizabeth Kubler-Ross. Mm-hmm. And she talks about when you're given a terminal diagnosis, you're going to have emotional issues. And you're going to go through stages of denial. I don't want this to happen. I'm denying it's going to happen. Mm-hmm. Then anger about it happening and you can't do anything about it. And then bargaining. And then despair. And at every one of those stages, it's very common for people to say, hey, let's get this over with. It's extremely common. That's the reason there's laws to not help people commit suicide.
May I interject and ask a question?
Let me, look, I'm the only person opposing this.
No, genuinely,
And so the laws are there to protect the emotionally vulnerable, because otherwise it's very tempting to kill them.
So you're saying that by the nature of the diagnosis, that depression and even suicidal ideation comes with the diagnosis, and so by definition, you have to consider that person emotionally unstable.
You have to address those emotions first and foremost.
How do you assess Meg in this situation?
I think Meg is awesome. I personally, my experiences, I don't believe in pharmacology. I don't think you should be using opioids. I have got a real issue with contemporary medicine because it doesn't help. And non-steroidal, non-opioidal, there are pain management. Some of the best pain management comes from former poison. Some of this stuff that's being used, the poison of sea serpents in the South Pacific, has been refined because it's a neurological toxin. And that short circuits the neurology of the pain. A good friend of mine, Assemblyman Eric Seastrand, when this was proposed years ago, he was the most powerful advocate. He was dying of colon cancer at the time, yet he was walking around the floor of the state legislature. Why was he doing that? Because he actually had on his belt a little electronic device. It wasn't opioids. He wasn't getting shots of pharmacology. Yeah.
I have it.
Good, and there's more.
Just like high blood pressure medications
Yeah,
treat high blood pressure. And
Get off them.
no,
The people
they work. So does
people that
insulin
are
treats
on them,
diabetes. Opioids
they
get
need
people through the
them.
day. They can be a mother because they're taking
I
opioids.
can walk
They
in the
can-
morning
and
because
she's also on opioid
I've had
pain
5
medication.
spine surgeries. I've had over 20 surgeries. You're not going to tell me that some sea serpent is
something
going
is
to
gonna
help
cure
me
my pain.
walk or go to my child's softball game or go to her just any extracurricular activity. When I go to her softball game, I can't even sit on a bleacher. I have to stand there. You're not going to tell me that some alternative medicine is going to let me do that.
I want
I'm
to get
sorry.
back to this question because I
No,
think that
you want to
comparing
change the
pain-
law,
Yes, I
and in
do.
Canada right now,
This is
there
not
are
about
people-
Canada.
No,
and
it's
I would
about medical
respectfully
aid
like
in dying.
an opportunity to ask you a question.
Yeah, go ahead.
Do you find it more or less humane for somebody like the Eilert's beautiful daughter to have to suffer at the end of her life? She's terminal. What is more humane? To be able to go out on your own terms or to starve yourself to death?
I started thinking about volunteer euthanasia because I was in so much pain. When I got the green light, it was surreal. There was a huge sense of relief. I just felt like I finally had an off button. I could at any time say I've had enough suffering and plan this, which actually has given me a lot of stress relief. With stress relief comes a little bit of pain relief. Knowing that there's an out is so important for patients. Every waking moment is spent being tortured. I don't want to live in this pain.
You're not going to tell me that some sea serpent is
something
going
that's
to
gonna
help
cure
me
my pain.
walk or go to my child's softball game or go to her just any extracurricular activity. When I go to her softball game, I can't even sit on a bleacher. I have to stand there. You're not going to tell me that some alternative medicine is going to let me do that. This girl is not crazy. The
Yes, she
process
is.
she's going through.
I'm affirming her.
Okay,
I'm
but what
affirming her
saying-
emotions.
Okay, but what I'm saying is, it's not like she woke up one day and said, okay, I'm gonna do this. This is a whole process. She has tried everything. She has gone through this process, and when enough's enough.
I'm at the point of accepting the fact
She's
that,
at that
I don't
point.
have an ability to get better.
And I don't like this.
And I'm okay with that.
I don't want her to
And
do
my
it.
option is to end my life, and that's the option that I'm choosing.
Well, with all due respect, and I know Dr. Phil, that if you don't know her, you should, and that's Johnny Erickson Tata. Johnny Erickson Tata is in a wheelchair and has been since her early teens. And I've worked with the disabled community for actually now most of my life. And Johnny Erickson Tata is much worse off than her. Johnny Erickson Tata is much more debilitated.
Now, I want
I'm
to,
sorry.
I want
I'm
to get
sorry.
back to this question because I
No,
think that
you want to
comparing
change the
pain-
law,
Yes, I
and in
do.
Canada right now,
This is
there
not
are
about
people-
Canada.
No,
and
it's
I would
about medical
respectfully
aid
like
in dying.
an opportunity to ask you a question.
Yeah, go ahead.
Do you find it more or less humane for somebody like the Eilert's beautiful daughter to have to suffer at the end of her life. She's terminal, hold on. And she has to have voluntary expulsion of food and beverages. So she's she's starving herself. Or somebody who has the final dose of morphine to be put under an involuntary coma, than to have the self-determination when they are at the end of their life, determined by two physicians, which is what this legislation states in New York, that they are going to die. What is more humane, to be able to go out on your own terms or to starve yourself to death?
Well, and also in the legislation, share with them the aspect that you have to be of right mind.
Yes, and you have to be
there's
of
a
sound state of
protection.
mind.
And so, yeah.
And who determines that?
Right, so the physicians determine that.
Actually, if you looked at the laws that you proposed and are active in Canada right now.
But these are not the
We're not in
same
Canada.
law.
We're talking about New York.
New York State.
New York State.
No, we're talking, this is being legalized around the world.
But
She wants to go.
We are talking about New York, right here.
We're talking about abandoning a basic principle of Western civilization.
Called
Compassion.
Be humane
Compassion.
And compassionate.
You don't
That's
kill.
what we're talking
If you're
about.
talking about killing,
We're not
intentionally
talking about killing.
Oh.
She's dying.
Okay, if
Cancer was
someone-
She is
taking her
dying.
life.
No, I'm sorry. I
She is
taught
dying.
English. You don't have to teach English. You don't have
She
to
is
parse
dying.
language. If you're dying, that is an intransitive verb. I'm going to die. You're going to die.
Have you had pets?
But again, what's more humane?
You want to
Somebody
treat
going
somebody
out
like
on
a
their,
pet?
No.
but somebody
I'm
going
sorry.
out on their own
I'm sorry.
fruition.
I'm just
I'm
asking
sorry.
about your
Look.
compassion level.
Oh, well, thank you.
I'm just asking. I'm not
Yeah,
questioning. I'm
okay,
asking.
what is compassion?
Yeah, that's what I'm asking.
So it means to suffer along with, literally from the Latin, compassio.
I'm suffering
And
along
so-
with her,
and
and I
we're-
will be with
look-
her till the end.
And it's admirable. You don't have to kill her to be, I've been at deathbeds. I have
She
been
doesn't
at
want to
deathbeds.
suffer anymore. She is making this choice. She's of sound mind. I am going to support her. I watch her suffer every single day.
So your point is that because you disagree,
No, it isn't because I disagree.
You don't
It's
think
because
that-
the laws have done that. This is part of why the Hippocratic Oath, you mentioned in passing the Hippocratic Oath. It was there for a very specific purpose. You don't use the knowledge of medicine to kill another individual. You don't use the knowledge of medicine to kill another individual. We are not animals. One of the predicates of Western civilization is human beings are more than mere animals. That we have quality that you have to protect, and particularly an innocent, emotionally vulnerable person should not be killed. Now, there are actual nations that have adopted this. I'm sorry, but there are. And there are cultures, and it's critically important if you look at history, that the use of medicine to kill is destructive to that society. And an example might be, I know many don't know their history, unfortunately. We're all Americans. We get our knowledge from the television set, but I suggest reading history. And Justice Jackson of the Supreme Court, the good Justice Jackson, many don't know him, was on the Supreme Court at the end of World War II. And we defeated Nazism. That was significant. But Justice Robert Jackson said, hang on, just using your ability, your power over other people and defeating them, that's not justice. That's the use of raw power. Wait, now he
you can't
insisted.
filibuster. You got to let me ask you a question.
I'm not
here.
filibustering. I'm trying to educate people who don't know their own history.
Well, this isn't a classroom.
Well, I'm sorry. Not a classroom, and you're not open to new ideas, Phil. You've dismissed Kubler-Ross. You have said that you understand the emotional dynamics, but Justice Jackson said, when doctors are free to kill, you've departed from humanity. This is the person that has sworn to only care for you and never harm you. So the doctor-patient relationship is at the very heart of society. This
Here's
was
my
sent to
question
you.
for you. Are you saying that because you disagree?
No, it's
and
not
have-
because I
and-
disagree.
And have it.
It's not my opinion.
Okay,
It's
you
not
keep talking because you're disagreeing.
Let me.
So let him say his thing.
Yeah.
Well, he obviously,
Give
the
him
decision's
space.
been made, hasn't it?
No, I'm asking a
He's
question.
asking a question.
Which
I'm
one
asking
is
a
it?
question. Well, if you'll let me speak, you'll find out. You should be on the edge of your chair.
Yeah.
Are you saying that you don't feel that people should have agency in terms of making their own decision about what they want to do? Because this is something that they do. A doctor doesn't do it to them. It's something they do. And you're saying because you don't agree with it, that she shouldn't have the right to make that decision. If it's lawful where she's done it, you talk about a nation of laws. If the law is passed in New York and...
So any law that's passed is ethical because lawmakers passed it?
I think it's more.
No, you
ethical
can't
than
set up
letting
a
their
straw man to
24-year-old
It's not a
avoid...
daughter-
straw man.
You
I'm
can't set up a
explaining
straw man
medical-
to deflect my question.
No,
My
I'm
question
getting
is,
to your question.
are you saying that people should not have agency about their own body and their own health?
So you're saying this is entirely about autonomy?
No, I'm saying what I said.
Is this just an autonomy argument?
No,
No, well, you're not willing to say it. Use English.
I'm using
Agency.
English.
Okay, so people can do whatever they want. Is that the nature of? That's what a lot of people
That's
think.
not-
You're rephrasing my question instead of
Okay, so-
answering it.
Well, you're using linguistic words that misrepresent the change in the law.
Are there any other kind of words than
Yeah,
linguistic?
there are. Yeah, they're actually. Yeah, clarity. Clarity.
Well, it's
and the
pretty
fact that-
clear. Are you
Paul-
saying that people shouldn't have the right to decide what they do with their own bodies?
Okay, that's the law in New York right now. That's the law in New York right now. and
This
you're
is not
trying to
law in
change
New
it.
York right now. Right now, we are trying to give
No,
the ability
that's
for
right.
someone
Right
like
now,
their daughter
doctors
who is suffering from
cannot
cancer of
encourage
the tongue. You
patients,
saw the
give
picture.
them poison.
She had no other path forward,
So-
and
Okay,
that would be
now
the
answer my
compassionate thing to
question.
do.
I'm doing it. Go ahead.
You're
Say-
not answering my question.
Which
I've asked
is?
it 3 times.
You're saying this is about autonomy and people doing what they want?
I'm saying what I said.
Which is? No, say what. Oh, I'm sorry. I'm
A
really
woman
sorry.
who has dedicated her life advocating for those needing medical aid and dying. We're going to add her to the conversation after the break. Joining us now is Kim Cullinan, the president and CEO of Compassion and Choices, which is an organization committed to the patient's end-of-life choices, including helping to implement medical aid dying laws across the country. Kim, thank you for being here. You've been listening to all of this. What do you want to say?
I think that what's important about this is to remember that we're talking about the dying patient and the experience that they want at the very end of their life. What we see in this work is that when a person is terminally ill, mentally capable, and has a prognosis of 6 months or less to live, which is what all the laws in the United States are advocating for, and the person chooses that they want to use this option, that it really brings families together and it allows them to go out on their own terms, and it brings about profound peace of mind.
Mm-hmm. Do you consider this suicide?
It's absolutely not suicide.
Well, how is it not suicide if someone is taking an affirmative step to end their life rather than allowing it to take its natural course?
The people who want this option desperately want to live. There is a disease that's taking their life, and it's about allowing them the option to relieve that suffering. I think about it like on 9/11 when there were people up in the buildings and they knew that they were going to die and they jumped. Was that suicide? That was a person taking a step that they took to hopefully make the way they died a little bit less horrific.
But it was still their affirmative choice to do that rather than allow it to happen in a different way.
Out of an attempt to relieve their suffering. I think the problem with labeling it as suicide is it's really different when a person is already going to die. It's quite offensive to the dying person because they desperately want to live. So when you label it suicide, it's both problematic for the dying person, but it also causes confusion. When you think about the word suicide suggests that it's treatable, that there's a path forward. There's no path forward for a dying person. person, and that's the difference.
That it's hasty, that it's made out of emotion only. And there's a very logical component to what I've gone through
And
the last
she's
year deciding this.
taken all these steps. It's not like she woke up and said, okay, I'm not going to try anything. I'm just going to do this. She is, she's done everything she can. And my hope is, 6 days from now, 2 weeks from now, she might say, my stimulator is working, or she might change her mind. I don't want her to do this, but I want her to be at peace. And if this will bring her peace, then I have to support my friend.
Yeah, this is definitely as much about me wanting to live as it is about wanting to die, because I want to stop my
She
pain.
wants to stop suffering.
And that's not an option here.
And you had a question you wanted to ask?
I did have a question. You've worked with hospice.
Yes, ma'am.
And you've been next to dying people.
Many.
Many, many.
Yes.
And I can see that you have a heart, but I also know that if you were with a dying person, you would not talk to them or present yourself in the way that you are here today, right now. You would not be with my daughter like this. You would listen to her.
I actually would talk to the doctors first, because I don't think your daughter got proper treatment, to be honest. I'll be perfectly honest. I don't think your daughter got proper treatment, to be honest. I'll be perfectly honest.
It's actually a really good point.
Thank you.
And in New York, and
The medical profession has been
states,
bastardized.
in other states that don't have medical aid in dying, a lot of these hospice doctors don't have other solutions. And quite often, they will use the opioids to try to treat the pain and accidentally or intentionally overdose.
Yeah,
And these-
Well, and what would
you can have death.
what would you have suggested for somebody like my daughter, who apparently was not well treated?
and one of the most prominent hospitals with massive staff of
I
palliative
understand.
care.
We're seeing right now, nationally, the implications of what professional medical associations did regarding COVID and the rules they put
Okay,
out.
we're not going to talk about
No,
COVID.
they
We are
killed
talking
people.
about.
I know people who died from COVID because the medical profession
So do
said,
we.
no, we're going to unit it our way. The fact is that the medical profession needs to be held accountable. And if you have doctors free to kill, it's harder to hold them accountable. The situation that's being proposed by Compassionate Choices, these laws, they actually say if someone mentions suicide, and again, it's a very common expression, ideation when you get it. I might mention it. I'm going to need counseling when I'm given a terminal diagnosis.
You definitely will.
And so,
My doctors know that this is my
course.
plan, because they know I'm not mentally ill. My pain
No.
doctors are well aware of what I'm choosing
exactly,
to
and
do.
so is Elizabeth Kubler-Ross. It's the reason she founded hospice.
But what would you
And
advise
I don't
for
need a
their
5150.
daughter? That's what they asked.
MAID
As a
has
prisoner of war?
actually increased a lot of hospice referrals, right?
Yeah, medical aid and dying laws get implemented across the country. What the evidence and data shows is that it results in increased use of hospice care, better conversations between doctors and patients, and better palliative care training for doctors.
All for it.
Let me
all
finish.
for it, but not
Let me
intentionally
listen.
killing them.
Let me finish. And so the mere act of passing medical aid and dying and implementing those laws in a state improves end of care options across the board. So even people who don't have the option of medical aid,
That is not what the law
they
says.
have
No, I'm
to.
sorry.
No, the
We'll
laws
have to go
do
back to
not
the facts
say
of what the law.
that they.
And I don't
Where are you
appreciate
getting your facts from?
You should read the
from
bill.
law that was introduced in
Read
New
the bill
York and from
in New York.
No,
Compassionate
the
Choices.
law that was introduced in New
Compassionate
York.
Choices
No.
is committed to
What-
the path.
Patently false.
Okay,
Yeah.
who would
So you
know
should read
better
the bill.
what Compassionate
You should
read the
Choices
bill.
does than you
The bill's
or
changed about
president
5
of the
times over the past
organization?
few years.
So
the bill
will-
has changed.
See, that's right. It was just changed in Colorado as well. Originally, they say, oh, don't worry, you have to have 6 months.
Yeah.
Not anymore in Colorado.
In Colorado,
No.
you still have to have 6 months. There's
No.
nothing that has changed
No,
about
and you have
that.
to
Is
you have to make a request
No.
15 days apart. Well, they reduced those requests.
Yes, the waiting.
And those requests.
Let me explain what has happened and what hasn't happened. In Colorado, the law still requires a person to have a prognosis of 6 months or less to live. The eligibility criteria is unchanged. It does allow the waiting period to be reduced from 15 days. I think Colorado just moved it to 7.
Correct.
That is an important change to the law because what the evidence and the data shows is that a dying person is unable to get through the law and that those regulatory requirements were overly burdensome for a dying person. So there is a reduction in the waiting period, which was never one of the core safeguards. It was a safeguard it was a regulatory requirement that was put in place by the opposition. But yeah, the waiting period was reduced. The eligibility criteria is unchanged.
Next, before tonight's taping, we polled the studio audience to learn what side of the medical aid in dying debate most were on. But has anyone's position changed after listening to tonight's guest? We're going to find out after the break. Before tonight's taping, with the help of our good friends at Grab TV, we polled the audience to see their opinion on medical aid in dying. So let's see if your opinion has changed after hearing this discussion. The first question, if an adult were to have a terminal medical condition, do you believe a doctor should be allowed to prescribe a medication to end his or her life? The results before the show were 72% yes and 28% no. The post results were 77 and 23. So it went up from 72 to 77%. Question 2, if a person were to have a non-terminal medical condition but suffered from a debilitating mental illness, should a doctor be allowed to prescribe a medication to end his or her life? Before the show, it was 36% yes, 64% no. And then after, it was 45% yes and 55% no. So it went up a little bit there as well. Question 3, if a person had an incurable but non-terminal debilitating physical medical condition, do you believe a doctor should be allowed to prescribe a medication to end his or her life? The results before the show were 35% yes and 65% no. After the show, 54% yes and 46% no. So basically it went up on every category. Listen, this is obviously a very thought-provoking issue that everybody has to think about for themselves, what you would do if you were in that situation yourself. There are ethical concerns, there are moral concerns, there are religious concerns, and it's not something that you would ever come to lightly. I think any responsible physician, if they were actively participating in this, would have very high standards that would require people to have a reasonable period, that they would have to show consistency in their desires. They would have to go through serious psychological, psychiatric screening and testing. You would have to make sure that every possible alternative had been evaluated, because I think sometimes patients don't pursue their rights as aggressively as they should. They let doctors just tell them, hey, this is the deal. And I think it's important that you assert your rights and be sure you've investigated every avenue of pursuit, because there's no coming back from it.
That's right.
And I appreciate all of y'all being here to discuss this tonight. I hope it's been thought-provoking, and I hope you don't find yourself in that situation, but there's not any of us getting out of this alive. So we're going to have to deal with it at some point, some way, for ourselves and those that we care. Special thanks to New York Senator Jessica Scarcella Spanton, Kim Collinen from Compassion and Choices. Thank you for being here, as well as Brian Johnston. Thank you for being here and expressing your views on this. We'll see you next time. Thanks so much. I want to share an update on Meg from tonight's episode. Accompanied by her dear friend Kelly, Meg did travel to Switzerland to end her life, and I am told she passed away peacefully from a voluntary assisted death. Meg will be deeply missed and forever loved by those who were fortunate enough to know her.